Reproductive health. You have learned in Chapter 3 about human reproductive system and its functions. Let's discuss a closely related topic now, reproductive health. By this term, what do we understand? The term reproductive health simply refers to normal functions with healthy reproductive organs. It has, however, a broader perspective and includes the social and also the emotional aspects of reproduction. Reproductive health, according to the World Health Organization, means in all aspects of reproduction a total well being, that is, physical, emotional, behavioral, and social. Therefore, with people having functionally and physically normal reproductive organs in the society with normal emotional and behavioral interactions among them in all sex related aspects might be called reproductively healthy. Why reproductive health is significant to maintain and to achieve it, what are the methods taken up? Let us examine them. Reproductive health problems and strategies. In the world, India was amongst the first countries to initiate programs and action plans to attain total reproductive health at a national level and as a social goal. In 1951, these programs, called family planning, were initiated over the past decades and were periodically assessed. Covering wider reproduction related areas, improved programs under the popular name reproductive and child health care programs are currently in operation. Among people, creating awareness about various reproduction related aspects and for building up a reproductively healthy society, providing facilities and support are the major tasks under these programs. Governmental and non-governmental agencies, with the help of audiovisual and the print media, have taken various steps to create awareness about reproduction related aspects among the people. Also, in the dissemination of the above information, parents, other close relatives, teachers, and friends have a major role. Also, in schools, to provide right information to the young, introduction of sex education should be encouraged so as to discourage children from having misconceptions about sex related aspects and believing in myths. Proper information about adolescents, reproductive organs, and related changes, safe and hygienic sexual practices, AIDS, sexually transmitted diseases, etc., would help people to lead a reproductively healthy life, especially those in the adolescent age group. Educating those people, especially in marriageable age groups and fertile couples, about available birth control options, care of pregnant mothers, importance of breastfeeding, postnatal care of the mother and child, equal opportunities for the male and female child, etc., would address the importance of bringing up a desired size of socially conscious healthy families. Awareness need to be created to enable people to think of problems due to uncontrolled population growth, social evils like sex related crimes and sex abuse, etc., and to prevent them, take up necessary steps and thereby build up a socially responsible and healthy society. Successful implementation of various action plans to attain reproductive health requires strong professional expertise, infrastructural facilities, and material support. To provide medical assistance and care to people, these are essential in reproduction related problems like menstrual problems, contraception, infertility, abortions, pregnancies, delivery, STDs, etc. Implementation of new strategies and better techniques from time to time are also required to provide assistance to people more efficient care. To legally check increasing menace of female feticides, massive child immunization, etc., statutory ban on amniocentesis for sex determination are some programs that merit mention in this connection. Some of the amniotic fluid of the developing fetus is taken in amniocentesis to analyze dissolved substances and the fetal cells, to test for presence of certain genetic disorders such as hemophilia, sickle cell anemia, Down syndrome, etc., and determine the survivability of the fetus. This procedure is used to find out new methods and or to improve upon the existing ones. Research on various reproduction related areas are encouraged and supported by governmental and non-governmental agencies. Do you know that in Lucknow, India, at the Central Drug Research Institute, Saheli, a new oral contraceptive for the females was developed by the scientists? Increasing number of medically assisted deliveries, better postnatal care leading to decreased maternal and infant mortality rates and better awareness about sex-related matters, increased number of couples with small families, better detection and cure of STDs, and for all sex-related problems, overall increased medical facilities, etc., all indicate improved reproductive health of the society. Population stabilization and birth control. In the last century, the quality of life of the people improved significantly due to an all-round development of various fields. However, the growth of population had an explosive impact due to increased health facilities along with better living conditions. In 1900, the world population was around 2 billion, and in 2000 it rocketed to about 6 billion and 7.2 billion in 2011. In India too, a similar trend was observed. Our population at the time of our independence was approximately 350 million, which reached close to the billion mark by 2000, and in May 2011 it crossed 1.2 billion. Probable reasons for this are an increase in the number of people in reproducible age, a rapid decline in death rate, maternal mortality rate, as well as infant mortality rate. It was only marginal, though we could bring down the population growth rate through our RCH programs. The population growth rate was less than 2% according to the 2011 census report, that is 20 per thousand per year, a rate at which our population could increase rapidly. In spite of significant progress made in those areas, such as alarming growth rate could lead to an absolute scarcity of even the basic requirements, that is food, shelter and clothing. To check this population growth rate, the government therefore was forced to take up serious measures. To overcome this problem, the most important step is to motivate smaller families by using various contraceptive methods. In the media, as well as posters or bills, etc., you might have seen advertisements showing a happy couple with two children with the slogan Hum do hamare do. One child norm has have been adopted by many couples, mostly the young urban working ones. Two of the other measures taken to tackle this problem are statutory raising of marriageable age of males to 21 years and that of females to 18 years, and incentives given to couples with small families. To help prevent unwanted pregnancies, let us describe some of the commonly used contraceptive methods. An ideal contraceptive should be with no or least side effects, easily available, user-friendly, effective, and reversible. Also, it should in no way interfere with the sexual act of the user, the sexual drive and/or desire. Presently, a wide range of contraceptive methods are available, which could be broadly grouped into the following categories, namely natural or traditional, oral contraceptives, IUDs, barrier, implants, injectables, and surgical methods. Natural methods work on the principle of avoiding chances of sperms and ovum meeting. One such method is the periodic abstinence, in which from day 10 to 17 of the menstrual cycle, when ovulation could be expected, the couples avoid or abstain from coitus. It is called the fertile period as chances of fertilization are very high during this period. Conception therefore could be prevented by abstaining from coitus during this period. Another method is withdrawal or coitus interruptus, in which just before ejaculation the male partner withdraws his penis from the vagina so as to avoid insemination. Lactational amenorrhea method is based on the fact that during the period of intense lactation following parturition, ovulation and the cycle do not occur. Therefore, chances of conception are almost nil as long as the mother breastfeeds the child fully. However, only up to a maximum period of 6 months following parturition this method has been reported to be effective. Side effects are almost nil as no medicines or devices are used in these methods. Though of this method, chances of failure are also high. With the help of barriers in barrier method, ovum and sperms are prevented from physically meeting. For both males and females, such methods are available. Made of thin rubber or latex sheath, condoms are barriers that are used to cover the penis in the male or cervix and vagina in the female just before coitus so that the ejaculated semen could not enter into the female reproductive tract. Conception can be prevented by this. A popular brand of condom for the male is Nirodh. In recent years, due to its additional benefit of protecting the user from contracting STIs and AIDS, use of condoms has increased. Condoms, both male and female, are disposable, can be self-inserted and thereby gives privacy to the user. Barriers such as diaphragms, cervical caps and warts are made of rubber that are inserted into the female reproductive tract during coitus to cover the cervix. They block the entry of sperms through the cervix, thus preventing conception, and they are reusable. To increase their contraceptive efficiency, spermicidal creams, jellies and foams are used usually along with these barriers. The use of intrauterine devices is another effective and popular method. In the uterus through vagina, these devices are inserted by doctors or expert nurses. Presently available are the intrauterine devices as the non-medicated IUDs, copper-releasing IUDs, and the hormone-releasing IUDs. Within the uterus, IUDs increase phagocytosis of sperms and the fertilizing capacity of sperms, and sperm motility is suppressed by the release of copper ions. In addition, the hormone-releasing IUDs make the implantation unsuitable for in the uterus and makes the cervix hostile to the sperms. For the females, IUDs are ideal contraceptives who want to space children and or delay pregnancy. In India, it is one of the most widely accepted methods of contraception. Another contraceptive method used by the females is oral administration of small doses of either progestogens or progestogen-estrogen combinations. They are popularly called pills and are used in the form of tablets. For a period of 21 days, pills have to be taken daily, starting preferably within the first 5 days of menstrual cycle. After a gap of 7 days during which menstruation occurs in the same pattern, it has to be repeated till the female desires to prevent conception. They alter the quality of cervical mucus to prevent or retard entry of sperms as well as inhibit ovulation and implantation. Pills are well accepted by the females and are very effective with lesser side effects. Saheli contains a non-steroidal preparation and is a new oral contraceptive for the females. It is a once-a-week pill with a high contraceptive value and very few side effects. By females, progestogens alone or in combination with estrogen can also be used as implants under the skin or injections. Their effective periods are much longer and their mode of action is similar to that of pills. Within 72 hours of coitus, administration of progestogens or progestogen-estrogen combination or IUDs are used as emergency contraceptives and have been found to be very effective as they could be used to avoid possible pregnancy due to casual unprotected intercourse or rape. A terminal method to prevent any more pregnancies such as surgical methods, also called sterilization, are generally advised for the male or female partner. Gamete transport is blocked by surgical intervention and thereby prevent conception. In male, sterilization procedure is called vasectomy and tubectomy in female. A small part of the vas deferens is tied up or removed through a small incision on the scrotum in vasectomy, whereas a small part of the fallopian tube is tied up or removed through a small incision in the abdomen or through vagina in tubectomy. The reversibility in these techniques is very poor but are highly effective. It needs to be emphasized that in consultation with qualified medical professionals, the selection of a suitable contraceptive method and its use should always be undertaken. One must also remember that for the maintenance of reproductive health, contraceptives are not regular requirements. They are in fact practiced against a natural reproductive event, that is, conception or pregnancy. Either to prevent pregnancy or to delay or space pregnancy, one is forced to use these methods due to personal reasons. No doubt in checking uncontrolled growth of population, the widespread use of these methods have a significant role. However, their possible ill effects like nausea, breakthrough, bleeding, abdominal pain, irregular menstrual bleeding, or even breast cancer, though not very significant, should not be totally ignored. Medical termination of pregnancies. Voluntary or intentional termination of pregnancy is called medical termination of pregnancy or induced abortion before full term. In a year, nearly 45 to 50 million MTPs are performed all over the world, which accounts to one-fifth of the total number of conceived pregnancy in a year. It is being debated upon in many countries whether to accept or legalize MTP or not due to emotional, ethical, religious and social issues involved in it. Government of India, to avoid its misuse, legalized MTP in 1971 with some strict conditions. To check indiscriminate and illegal female feticides, such restrictions are all the more important, which are reported to be high in India. Why MTP? Obviously, the answer is to get rid of unwanted pregnancies either due to failure of the contraceptive used during coitus or rapes or casual unprotected intercourse. In certain cases, MTPs are also essential where continuation of the pregnancy could be harmful or even fatal either to the fetus or to the mother or both. Up to 12 weeks of pregnancy, that is during the first trimester, MTPs are considered relatively safe. Much more riskier are the abortions in the second trimester. One disturbing trend observed, which are not only unsafe but could be fatal too, is that a majority of the MTPs are performed illegally by unqualified quacks. The misuse of amniocentesis to determine the sex of the unborn child is another dangerous trend. Frequently, it is followed by MTP if the fetus is found to be female. This is totally against what is legal because these are dangerous both for the young mother and the fetus. Such practices should be avoided. The mentioned unhealthy trend could be reversed by effective counseling on the need to avoid unprotected coitus and the risk factors involved in illegal abortions, as well as providing more healthcare facilities. Sexually transmitted infections, collectively called sexually transmitted infections or venereal diseases or reproductive tract infections, are infections or diseases which are transmitted through sexual intercourse. Some of the common STIs are gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, and of course the most discussed infection in the recent years, HIV leading to AIDS. Among these, in Chapter 8, HIV infection is most dangerous and is discussed in detail. Some of these infections can also be transmitted by sharing of injection needles, surgical instruments, that is, like hepatitis B and HIV with infected persons, transfusion of blood, or from an infected mother to the fetus too. Other diseases are completely curable if detected early and treated properly, except for hepatitis B, genital herpes, and HIV infections. Early symptoms of most of these are minor in the genital region and include itching, fluid discharge, slight pain, swellings, etc. Infected females may remain undetected for long as often they are asymptomatic. In the early stages, absence of less significant symptoms of infection and the social stigma attached to the STIs deter the infected persons from going to timely detection and proper treatment. This could lead to further complications which include abortions, pelvic inflammatory diseases, ectopic pregnancies, stillbirth, infertility, or even cancer of the reproductive tract. A major threat to the healthy society are STIs. Therefore, under the reproductive healthcare programs, prevention or early detection and cure of these diseases are given prime consideration. Though of these infections, all persons are vulnerable. Persons in the age group of 15 to 24 years, the age group of which you also belong, their incidents are reported to be very high. Because prevention is possible, there is no reason to panic. By following the simple principles given below, one could be free of these infections. 1. With unknown partners or multiple partners, avoid sex. 2. During coitus, always try to use condoms. 3. In case of doubt, for early detection and get complete treatment if diagnosed with infection, one should go to the qualified doctor. Infertility. Without a mention of infertility, a discussion on reproductive health is incomplete. All over the world, including India, a large number of couples are infertile, that is, in spite of unprotected sexual cohabitation, they are unable to produce children. For this, the reasons could be many: congenital, drugs, diseases, physical, immunological, or even psychological. For a couple being childless, often the female is blamed in India, but more often than not, the problem lies in the male partner. In diagnosis and corrective treatment of some of these disorders, specialized healthcare units could help and enable these couples to have children. Where such corrections are not possible, however, through certain special techniques commonly known as assisted reproductive technologies, the couples could be assisted to have children. One of such methods is in vitro fertilization, followed by embryo transfer. In this method, as popularly known as test tube baby programs, where sperms from the husband or donor and ova from the wife or donor are collected and under simulated conditions in the laboratory are induced to form zygote. Into the fallopian tube, the zygote or early embryos could then be transferred, and into the uterus, embryos with more than 8 blastomeres could be transferred to complete its further development. To assist those females who cannot conceive, embryos formed by in vivo fertilization also could be used for such transfer. Collected from a donor, transfer of an ovum into the fallopian tube of another female who cannot produce one but can provide suitable environment for fertilization and further development is another method attempted. Another specialized procedure to form an embryo in the laboratory is intracytoplasmic sperm injection, where a sperm is directly injected into the ovum. Artificial insemination technique for infertility cases, which could be due to inability of the male partner to inseminate the female or due to very low sperm counts in the ejaculates, could be corrected. The semen in this technique is collected either from the husband or a healthy donor and is artificially introduced either into the vagina or into the uterus of the female. All these techniques, though options are many, require expensive instrumentation and extremely high precision handling by specialized professionals. Therefore, only very few centers in the country these facilities are presently available. Obviously, only to a limited number of people their benefits are affordable. In the adoption of these methods, emotional, religious and social factors are also deterrents. Since all these procedures, the ultimate aim is to have children in India, we have so many orphaned and destitute children who, unless taken care of, would probably not survive until maturity. Our laws permit legal adoption, and for couples looking for parenthood, it is as yet one of the best methods. Thank you so much for watching. Please share this video with your friends. Leave your comments below and please subscribe to my channel for more content. Click that bell notification that would let you know when a new video is uploaded. Thank you so much for watching. Once again, please subscribe to my channel for more content. For more videos, please check the description box down below.